Hello guys, in this video we are going to study about drugs to stop before surgery or the PAC. It's a topic from anesthesiology and questions are asked often from this topic, right? So first of all, NPO orders. NPO means nil per oral orders. Before surgery, we ask the patient to not to take any feed by mouth, right? So in adults, it is 6 hours for semi-solid fluid. You have to remember it, very important. For liquid in adults, it is 2 hours. And also for the pediatric group age, NPO for semi-solid, it is 6 hours NPO for semi-solids. For breast milk, it is 4 hours. And for clear fluids like water, it is 2 hours. Right, so it is a very important thing, you have to remember it. Now coming to orders to stop the medication. First of all, antihypertensive drugs. Antihypertensive drugs are continued till day of surgery, right? Continued till day of surgery, very important. Oral hypoglycemic agents. In case of oral hypoglycemic agents, if the patient is undergoing a minor or moderate surgery, then stop the last dose of drug. Stop the last dose, right? If the patient is undergoing a major surgery, then stop the oral hypoglycemic agent. We are not talking about insulin. We are talking about oral hypoglycemic agents, not insulin, right? If the patient is undergoing a major surgery, then stop the oral hypoglycemic agent and then start on insulin, right? And start on insulin. Antipsychotic, antidepressant and anti-epileptic, all three are CNS drugs, are continued till day of surgery, In case of TCA, right, tricyclic antidepressants, stopped 3 weeks prior, In case of lithium, which is a drug which is given in bipolar disorder, it is stopped 24 to 48 hours before surgery, right? If only one thing is asked, then go for 48 hours. Then coming to anticoagulants. In case of anticoagulants, aspirin is continued till day of surgery. Aspirin is continued till day of surgery. What about clopidogrel? Clopidogrel is discontinued 5 to 7 days before, right? Stopped 5 to 7 days before. Ticlopidine is stopped very earlier, 14 days before. In case of low molecular weight heparin, it is stopped 12 hours before surgery. And in case of warfarin, because it has a longer half-life, means not longer half-life because it affects the vitamin K and in the liver, so the enzyme which it stops takes more time to regenerate. That's why it is stopped 3 to 4 days before surgery, right? 3 to 4 days before surgery. It is a note, very important note, gap between surgery and stenting procedure should be dash for bare metal stents. For if we are putting a bare metal stent, then the gap between the stenting procedure and another surgery should be 1 month. And in case of medicated stent and the surgery, it should be 1 year. What is case of the steroids? In case of steroids, the steroids are continued with perioperative supplementation. Steroids are continued with perioperative supplementation, means they are not stopped, right? But it is stopped only in 3 cases. Stop steroids in 3 cases. First is if you have diabetes. In case of diabetes. Second, active infection. And third is immunocompromised states. So these are the situations when you have to stop steroids before surgery. In case of herbal medication, stop 4 to 6 weeks earlier before surgery. In case of hormone replacement therapy, it is 4 to 8 weeks or 1 to 2 months before surgery. What about smoking? Smoking should be stopped as soon as possible or at least 2 months before surgery, right? So this is everything and you have to remember it by heart. Thank you.